Et donc nous sommes de retour. Cette fois-ci, j'ai avec moi sur le plateau Alex Diaconu, CEO et fondateur de la société IeHealth, basée aux États-Unis. Cette entreprise a pour mission de redonner à ses clients le contrôle sur la data santé. Welcome, Mr. Alex.
Thank you for having me here today, Besma.
Thank you for coming. First of all, we ask this question to all our guests. What is it like to be in Morocco, and what is it like to be and to participate to the eHealth Forum that's taking place today in Morocco?
Well, actually, it's my first time in Morocco.
Okay.
And
how is it going so far?
It was a beautiful surprise to see how animated and how big this event is. And I look forward for the sessions and to learn new things, not only about the Morocco healthcare ecosystem, but also about the innovation in healthcare, as I see so many participants exhibiting their solutions here. So, looks amazing.
It does look amazing. Let's talk aging populations. You told me earlier that in 5 years, 1.4 billion people will be over 16 years old. Can you tell us more about it?
Yes, actually, aging population is recognized this year as the second biggest challenge in the world after climate change.
Okay.
Nowadays, there are around 1 billion people over 60 years old living all over the world. In 5 years, so by 2030, we will have an over 40% increase, reaching 1.4 billion. Imagine the whole population of China being over 60 years old.
It's huge as a number.
In Japan, nowadays, 30% of the population is over 60 years old. In China, by 2030, 30% of the population, 30% of the population means the population of Europe, will be over 60 years old. In Europe, by 2040, 30% of the population will be over 60 years old. In the US, by 2050. If you look in the Middle East, we will see increase of 50% in the next 5 years of the people over 60 years old. Even in Morocco. In Morocco, you have 10% of your population nowadays considered aging population.
As elderly.
And by 2030, you'll have
number
15%.
Will go even higher.
Yeah, so it will be
50%.
15%. So you'll have basically the same 50%.
How is it challenging to have elderly population?
The biggest challenge comes from the fact that 75% develop at least one chronic condition.
One chronic disease.
And if you combine this with the fact that our lifespans increase and understand that a chronic patient puts a lot of pressure on the healthcare ecosystem, and you understand that if we increase our lifespans, this pressure will be for a longer time.
And we've seen it throughout COVID.
Yeah.
Yes.
So the healthcare system all over the world have two big challenges. One, the fact that by 2030, with all the good impact of AI, we will still miss or lack 10 million healthcare professionals.
10 million.
And if you look at the percentage of GDP spent on healthcare system, and you will see that by 2030, US will reach nearly 20%, and Europe will go close to 17%. You understand that we don't have the medical capacity,
resources to face,
and we don't have the financial resources. So the real question is, how are we going to solve this challenge?
How are we going? That was my question to you, Mr. Alex.
Okay.
How is it possible to address this challenge?
Actually, there is only one way.
Which is?
Self-care. So empowering individuals, so each of us, to be able to take care of our own health. And how do we do that?
Each one of us is responsible for its own health.
Yeah. We have a healthcare system that is struggling.
Okay.
Medical doctors are overwhelmed all over the world. We need to become partners with all the stakeholders in the healthcare systems. We need to be partners with the doctors. We can't be passive anymore. And the way for us to be able to carry out self-care is first to be empowered with our health data, because we can't improve what we don't measure.
And that's actually what your company IeHealth is doing. It's helping its clients
Exactly.
have control over their health data.
We at IGEA are building a decentralized infrastructure for health data and AI to empower individuals to take ownership and extract value of our own data. Basically, there are two stages. First, to empower each of us with our data, and then to leverage this data using very personalized autonomous AI agents to manage our health. All the time invite people to imagine being a billionaire. What we would do? We would probably buy the biggest house, the biggest plane, several cars. But the next thing we will do is that we will employ people, professional people, to manage different things for us. And health would be one of the major things that we would like a professional to take care for us. But we are not all of us billionaires.
Certainly not.
The good news is that AI will bring a solution for us. We will be able to hire, if you want, or to own AI agents. An AI agent basically will be able to look into our data and identify potential risks and guide us like a human being would do in taking the right decisions, especially around preventative care. Instead of just focusing on sick care and treating diseases,
You're being preventive.
it's wiser
Yes.
to focus on early detection and preventative care. Even for AI agents, there are going to be at least two stages.
Is it effective to be diagnosed by AI? May I ask?
Effective?
Yes,
Definitely yes.
definitely.
Yes. AI is going to take care of all the aspects that are repetitive. There are heavy loads. And also, AI brings for the first time the possibility to look into vast amounts of data and determining connections or relationship between that kind of information that previously we could have not understood or seen. An AI agent will definitely outperform a single medical doctor. And very often we ask the questions, is AI going to replace medical doctors?
Yes.
And all the time I give this answer. No, but medical doctors empowered by AI or augmented by AI will replace medical doctors not using AI.
Do not use AI.
Imagine AI as a new kind of capacity. And we must understand that this capacity in healthcare should not only augment medical doctors, but also each of us. So we will have incredible advantages by using AI for our own health.
That's for sure. My other question to you, Mr. Alex, is going to be about the vision of digitalization when it comes to health. You see, in Morocco, we just we have announced the strategy, the digital strategy 2030. What do you think about the vision, our vision of digitalization?
I was here today at the opening ceremony,
Yes.
where your government officials talked about the vision, and it's the right way forward. Also, there is another side. Of course, we need good leaders and good vision. But that vision is as good as we will be able to execute it. So it's not only a governmental responsibility, it's also about the healthcare system to implement such a vision, and in the end is about each of us, may it be medical doctors or just individuals, understanding that embracing technology is the only way forward to tackle existing problems in healthcare. So you have the vision. The question is, are you going to be able to implement it?
To implement it.
Yeah. So, and this is not only about, let's say, decision at the governmental level. You will need to transfer the vision as close as possible to the doctor and as close as possible to each citizen of Morocco. And I hope you will do it. You have 5 years.
We do have 5 years. The clock is ticking, as we do say. I have one last question to you, as someone who is investing in healthcare. Do you see yourself invested in Morocco one day?
I need to learn more about the ecosystem here. But as we talked about self-care as being the only way forward for a sustainable medical system, I would be happy to see here the opportunity to build this new vertical, as I do it in the US or Europe or the Middle East. Still, I would need local partners
For sure.
to support me in this endeavor, as it's not only about financial investment or technology, it's about people.
Indeed.
And seldom I say that we are all going to become somehow cyborgs, and it's not a joke. We are going to merge with technology very soon. We see implants, we see different kind of tech or medtech devices implantable. So it's here, we see it. It's very important for us to understand that we need to maintain our human traits and maintain control over the technology. So yes, we are interested to build a healthcare vertical in Morocco, but together with the right entities and in the end with the right
partners.
human partners.
Partners. Beautifully said. Thank you so much, Mr. Alex, for
Thank you, Besma,
honoring
for
our
having me
invitation.
here today.
Such a lovely chat. Thank you.
You're very kind. Thank you.
Thank you. Mesdames, Messieurs, donc restez avec nous parce que notre couverture n'a toujours pas pris fin.